Hello there, my lovely. Make yourself comfortable. My name's Dr. Sarah. Pleased to meet you. Could you just confirm your name for me, please? Okay, that's perfect. So what can I do for you today? Alright. You think your ears need cleaning out? Okay. We can do that. Do you have pain? Pressure. Okay. And do you have problems with earwax build-up? Yes, I can see here that you do. You do. Okay. It's very natural for some people to get a build-up quite often. It varies, but you're obviously one of those people that does get that build-up. Okay. You're not feeling unwell in any other way? No recent infections, colds, flus? Okay, that's fine. Do you have allergies at all? Yeah, okay. Perfect. Alright, so I think what I'll need to do first is take a little look at you, alright? Yeah, have a look around the outer ear, down the ear, and then see where we need to go from there, okay? Alright. Do you have an allergy to latex at all? Okay. I'm just going to pop some gloves on. Okay, let me just give the ear a little wipe around. Okay. I'll start with your left side here. And just a gentle wipe around. Just to clean off any dust or debris you may have picked up en route. Okay. Do your other ear now. There we go. Okay, so you've not experienced any pain on your outer ear at all that you've noticed? Okay, well I'll start with your right ear and I'm going to have a little press around first, okay? Tell me if anything's uncomfortable. Alright. Gentle pat around. Okay, I couldn't feel any lumps or bumps. Did that feel okay for you? Good, okay, let's take a look at this side now. Same again. Just a little feel around and some little pats. feels fine. No pain there? Okay, that's good. Have your ears been itching at all? No, they just feel quite clogged and, yeah, just some pressure there. Okay, so I'll need to have a little look down with the otoscope here. I'm sure you've had this done plenty of times. Just a little light on the otoscope and the specular here goes into the ear, okay? Alright. I'm just going to have to pull up and back very gently to do this, okay? Here we go. Right, here we go. Just popping it in now, my lovely. Oh, there is a lot down here. I can't see the eardrum, there's a lot of wax, a lot of impacted wax. You can see it's gone quite dark, so it's been there a while. Just reposition. Okay, I'll withdraw that now. Definitely a big impaction down that ear. Yeah. Yeah, it can be uncomfortable for sure. I'm pretty sure that's what's causing your discomfort. Let me just check this other side. Okay, just going to pull up and back then, my lovely. And insert in the otoscope now, okay. There we go. Same again here. Lots of impacted wax. There's a huge build-up in your ears. Okay. Right, let me take that out of there. Okay, so I think the best way to move forward with this is for me to try and soften that wax and then see how much I can remove by hand, okay? There are alternative methods we can use, but I would rather just try and soften it first, okay? Because there is a lot down there, it might be a little bit uncomfortable, so I'm going to pop you some anaesthetic drops down your ears first, okay? And then I'm going to pop some lovely fizzy drops down, so you'll get all the drops today. Okay. These won't sting, burn. Nothing that I'm going to put down there today will cause you discomfort. I just don't want to make you feel more uncomfortable when I'm removing any wax. Because I'd like you to come back to me if you need to see me again. I don't want to scare you away. Okay. Let's just pop some down here. Right, I'm just going to pop two down here. There's one. And two. Okay. You all right there? Good. And a couple down here. Okay, here's one. And two. Right, I'm just going to check that they're working. I'm just going to gently touch inside your ear with this tool and you can tell me if you can feel it or not. Alright? Okay. Just let me know if you can feel this one, okay? Yeah? Okay. Right, okay, that's fine. They work very quickly. And this side. You can't feel this? Okay. That's perfect. Okay, let me just update my notes there. Right, so let's get my other drops now. Now these are the exciting ones that fizz and crackle. They basically break down earwax. If it doesn't get rid of everything on the first go, I can also put some more in to get a little bit further down. Okay. Right. Let's go with your left one. I'm going to put 3 down. Okay, to start with. Okay. Here's 1. And 2. And 3. Okay. Good, you like the sound? Perfect. Most people do. Feels rather pleasant. You may even start to get some relief from the pressure already. Don't forget your ears are going to be somewhat numb now for a while. Here we go. Here's 1, 2, and 3. Give that a little roll. There. Fizzing nicely. Perfect. Okay. Alright. So, I'm going to use this long spoon-shaped tool to start to scoop away the wax, and I'm hoping it will come away without too much of a fight. As I said, I can put some more drops down, but I need to have a little look first to see what I can get, okay? Alright, keep nice and still for me for this. If anything's uncomfortable or you want me to stop, please just pop up your hand. Try not to move your head, okay? Here we go. just have a little look down there now with the otoscope. Okay, just going to put that in. Right, it's still quite solid down the bottom, so I'm going to pop another couple of fizzy drops in. Okay. Right. Are you alright there, my lovely? Good. Right, another couple of drops. One and two. I see you're closing your eyes there. That's nice. Oh, you find it relaxing. That's perfect. Okay, another little scrape around now, my lovely. That's got the rest of that out of there. Just have another little look. Yeah, that's looking better. I just need to give it a little brush up in a few minutes when I've done the other side. I'll let that settle for a bit. Okay. So there's a lot come out of there. I can see your eardrum now, so that's good. I'm just going to have a little go on this right side, see what we can get out of there. Okay? Righty. Okay, and keep nice and still for me, my lovely. Out of there, let's have a little look with the otoscope again. Let's pop that. There we go. A little bit down there. I'll just pop another drop in there. Okay. going to give your ears a little brush now. So I have just a very special little brush which might sound a little loud to you in your ears, but it will just help remove some of the excess little bits that get trapped onto the hairs in your ears, okay? Again, tell me if it's not comfortable for you. Yeah, good, I'm glad you couldn't feel that. Your ears will be numb for a little while. Okay. Right. Let's get a brush. There we go. Okay. How is that? Good. Do your ears feel better now? That's good. Right, you're in for a treat today because you get triple drops. These are just soothing ear drops now. Okay. See how you go. I mean, you'll probably need to come back again if you're just one of those unlucky people that naturally gets a lot of build-up. But any problems in the next few days to a week, feel sore, itchy, discharge, any fevers, just come back. But I'm sure you're fine. I can't see any signs of infection. All right. Okay, just a couple of these now. Okay, 1, and 2. Okay, good. And 1, and 2. Okay, so that's you all done. Good, enjoy the rest of your day. I'm glad that wasn't too bad for you. Yeah. So, like I said, we'll see you soon if needs be. But any more problems in the next month or so, up to a few months, just come back to us and we'll take another look at it for you. Okay? Alright then, you take care. Bye-bye. Oh, hello there, my lovely. Make yourself comfortable. I'll be right with you. Just just getting a couple of things ready there. So, you're here for me to do your ear cleaning today, yeah? Okay. Right. Yeah, you've been having a lot of problems. Yeah, they're rather painful now. Okay, well I've got some good notes on the system, so I don't need to go through all that again. I'm sure you've answered enough questions. Yeah, but it's good we've managed to get you back in to get this done. Yeah? Okay, well what I'm going to do is pop some gloves on and I'm going to have a little feel around the external ear. Make sure that there's nothing untoward going on there. It's warm today, isn't it? Yeah. Our air conditioning's not working either, so it's been rather unpleasant. Okay. So you've been getting some pain in your ears and around your ears, yeah? Okay. Right, well I'll have a little feel around first before I look down, okay? I'll start with your left ear if that's alright. Okay. So, let's just have a little palpate around there. So, could you tell me, is this painful? A little bit sore there, okay. Just going to move your ear forward so I can just have a little look behind. Anything painful there? Okay. Just gently going to tug on your lobe. That's a little bit painful, okay, lovely. I can't see any redness on the external ear, so that's good, and there's no lumps and bumps. Okay. You alright there? Good. Let me take a look at your right ear now. Okay. Is that painful? A little bit sore. Okay. Just going to pull the ear forward a little. That's all. Okay. And a little tug on the lobe there. Alright. Okay, so I don't see any problems on the outer ears at all. Skin looks normal, no lumps and bumps, no redness, no scaling, no discharge. Yeah, I think the bulk of your problem is coming from the ear canal. Alright, and possibly in the middle ear, but I can't see just at the minute, but I will have a good look at that, okay. Yeah. Yeah, you've had a problem with wax build-up for a while, so I'm going to have to remove that wax before I can see the eardrum, I'm guessing, but we'll take a little look now, alright? Okay, so I'm just going to use this otoscope. Okay, so it has a light on it. Can you see the light there? Just helps me look down, alright, and see what's going on. Please keep still. Tell me if anything's uncomfortable by popping up your hand, okay? Alright. Let's start here. I'm just going to gently insert that now, my lovely. Okay. Is that sore? Okay, right, bear with me. I'm going to pop some drops down your ears just to numb the ear canal up a little bit. Yeah, if that's sore for you, I don't want it being too uncomfortable for you, and these drops work very fast, okay? I'd rather do that first than have you feeling uncomfortable. Let's pop a couple of these in each side for you, my lovely. Here we go. There's one. And two. There, they'll feel nice and cool. Okay. Here we go. So there's one and two. Lovely. There. You alright? Good. Okay, so your ear canals will be numb now. And I'll be able to take another look down now, or attempt to. Again, just pop up your hand if it's sore, okay? So, just going in again now. Okay, here we go, lovely. Is that better? Good, good. Right, okay. So you have a large lump of impacted wax down there and some rather red looking ear canal walls. So I can't see further down there now to look at the eardrum, but I'll soon get to work on clearing that out for you, my lovely. Okay. Right, I'm just going to withdraw. Yeah, just go. There we go. Is that alright? Good. Much more comfortable with the anaesthesia drops, isn't it? Yeah. Okay. And just popping this in again now, okay? Right. Again, very red, irritated walls and large impaction down there. I can't see too much. Right. I'm going to withdraw that. Right, I'm going to pop some drops down your ears again, but this time this is going to soften the wax, okay? Because I don't want to go poking around while it's so hard. Yeah? Okay, so let's get some different drops now. Okay. Give these a good little mix up, and these will fizz. Okay, right, I'm going to pop 3 down each ear, alright? Here we go. So here's 1, There. You shouldn't feel too much with the ear being numb. Alright? Might feel a little bit of a strange sensation as the drops run down a little bit, but it should be okay. Alright. Okay. Here's 1, 2, and 3. Okay. Are they fizzing nicely? Good. You like that? Perfect. Okay. Just update those notes. So what I plan to do is use the otoscope again, but I'm going to use this tool here, and it passes through the otoscope and I can see and start scraping around. Okay? Yeah? I'll be very gentle, and then once I've done that and removed the wax as best I can, I'll then go in with this special brush and clean around. Okay? Is that alright? Good, good. So you just relax there for a little while and I'll just get everything ready. Okay? Alright. Okay then, let's begin. So you just keep nice and still again for me, and I'll just get my light on there. Perfect. Okay, and I'll begin popping the otoscope into the ear, alright, and then passing this tool through, alright. Alrighty. Okay. Here we go. Just going to pop the otoscope in there. Okay. Right, here we go. Nice and still for me. Okay. Just gently going to scrape away. Is that okay for you? Good. going to remove the tool. Okay. Right, and just have a look around. That's the bulk of it gone. Perfect. I'm just going to remove that now. Right, I'm just going to use the little brush, alright? Okay. You've done really, really well. Okay. Here we go with the brush. Just keep nice and still again for me, my lovely. There, that's looking so much better now. Yeah, it feels better. Perfect. Right, now I need to take a look at this right here now. So I'm going to do the same thing again. I'll be passing this tool through the otoscope and just having a little gentle scrape around, then I will use the brush. Okay? Alright. Alright then. Here we go, my lovely. Just passing that through. to use the nice little brush again. You're doing so well, nearly done. And that's that, all clean again. I'm just going to pop another type of drop down the ear just to soothe them, okay? And I'll get the pharmacy to get a bottle of those drops for you to take home. Just use them for about 5 days, okay? Any problems, you can just call us and come and see us again, of course. Right, okay, so let's get those. Right. You're still going to be numb at the moment, but these feel really, really cool when they go in the ears. You're not dizzy or anything? You're feeling okay? Good. Feels more comfortable. Perfect. Okay. So just 2 drops down each ear. You'll need to do this just twice a day, okay? But I'll do this now for you. Okay, there's 1 and 2. To the side. Here's 1 and 2. Okay then, my lovely. So that'll help soothe the ears. The anaesthesia should wear off in about an hour. You may feel a little bit sore, but hopefully all that tenderness that you're feeling will go away now your wax impaction has gone. Yeah. Luckily it wasn't pushing against the ear canal too much, and it doesn't look like there's any problems behind the eardrum. Yeah. Maybe we need to check your ears a little bit more often just to stop it getting so impacted again in the future. Okay, my lovely, well, pop out to reception in the pharmacy on your way. I'd like to see you back in about another 5 days, so make an appointment and then collect your drops, alright? Okay, but do remember, any problems, just give us a call. Okay, take care now. Bye-bye.